Hello, Assalamu alaikum everyone. Good morning. Bismillahirrahmanirrahim. I am starting with the lecture number 9 on autopsy. And in this lecture, I will be discussing the external examination of the body. In the previous lecture, we discussed the examination of clothes. But in this lecture, I will be discussing the examination of the external body surface. And the most important step, which is usually missed, is that all the body sides at the front, back, both lateral side should be examined carefully. Natural orifices like mouth, ear, nose, eyes, anal and vaginal orifices, they should be examined thoroughly because some hidden injuries may be there. Then the clefts of groin, axilla, the natal cleft, they should be also carefully examined to see any hidden injury. The external examination of the body surface, it includes thorough inspection and palpation of the body surfaces. Inspection is done with the naked eye as well as with the help of magnifying lens. And this is done in 3 steps. General physical examination of the body, external examination, external evidence of injury, and external evidence of therapy. That means the person was injured, he was hospitalized, and there was intervention, medical intervention, and those evidence of therapy should be noted. Regarding general physical examination, this is done for general parameters and the visible changes after death. Visible changes, that is the changes which appear after death, like postmortem staining, cooling of the body, rigor mortis, they should be examined. Then visual scrutiny, that means searching for the injuries, therapies, or other evidences. In general parameters, we see the age, sex, weight, physique, build, and the body length. And this is a usual remark which is written down that it is a dead body of adult male person of well built, having body length 162 centimeters and appears to be of above stated age. That the age which the police or the relatives have narrated, it appears to you as the above stated age. Now the visible changes which after death are the postmortem changes which appear in a definitive chronological order. As these changes appear in a definitive chronological order, these changes are important parameters for the estimation of time since death. And these changes are cooling of the body, postmortem staining or lividity or hypostasis, rigor mortis or rigidity, and putrefaction. So as the bodies are stored in freezers, so these parameters, the parameter of temperature for the estimation of time since death is usually not applicable. This is the contact flattening and the postmortem staining appears at the back. Now the visual scrutiny, you should comment about any special change which is noted, like the change in the color of the skin, color of the postmortem staining, like jaundice, congestion, cyanosis, or any physical abnormality or defect, any surgical scar, or any fresh surgical incision, or any other mark on the body. So body should be completely scrutinized for any other change which is visible. This is cyanosis. The nails are appearing blue. Then external evidence of injury. Complete examination of the surface of the body is done to find out any injury. All the hidden areas should be looked: axilla, oral cavity, groin, umbilicus, and genitalia. So this is a picture of injury. This is a penetrating injury. So each injury should be examined and it should be noted for its nature, that the type of injury, like it is incision, incised wound, lacerated wound, or firearm wound. Then its site and location in the reference to two anatomical landmarks or the body prominences. Then for its size, shape, depth, margins, angles, and any vital reaction, it should be noted down. These are the anatomical landmarks on the front view. These are on the back view, anatomical landmarks, and these are on the side view. So two reference anatomical landmarks are noted for the location of the injury. The injuries may be single or multiple. Each injury should be measured in length, width, and depth. Each and every injury should be recorded for its location in the reference to anatomical landmarks. If there are multiple injuries on a same area, they should be grouped together, like a wound complex of 9 elliptical incised wounds, each measuring 3 into 7 centimeters, all abdominal cavity deep, present in an area of 18 into 27 centimeters on the front of abdomen. So this is an example. If there are multiple wounds on a same site, they can be grouped together. These are various types of weapons which may be inflicting injuries. And these are the types of injuries like the contusion, abrasion, laceration, the incised wound, the punctured wounds, and the burns in various degree of healing, and complete charred body. Now, for the external evidence of therapy, any type of therapy, surgical or medical, should be categorically recorded separately in order to avoid confusion. They should be recorded under a separate heading, surgical or medical intervention, so that when at the end you write down your conclusion, they should not be mixed up with the injuries. Then the therapeutic interventions are like surgical incisions, dressings, drainage holes, catheter introduced into the body, stitches with the material of suture and the number of sutures. Tracheostomy hole, if any, should be noted. Needle punctures into the body cavity. So these are the therapeutic marks which should be completely noted. Thank you very much. So this is all about the lecture number 9, in which we have learnt about the body surface, marks of injury, marks for therapy, or any other noticeable change and the changes after that. Allah Hafiz, take care.